Greetings, students. We're moving pretty quickly in the semester, and today we're working on week 13, and we're going to be addressing chapter 18, Gender and Substance Use Disorders. So we're going to be looking at this chapter, and we're going to understand the different effects of various compounds on women as opposed to men. And we're going to try to comprehend the impact of gender on rehab process and review the historical similarities and differences for alcohol, drugs, and gender. So under chapter 18, gender and addiction history, men are more likely than women to use almost all types of illicit drugs. And illicit drug use is more likely to result in emergency department visits or overdose deaths for men than women. However, women are just as likely as men to develop a substance use disorder. Women may be more susceptible to cravings and relapse, which are key phases of the addiction cycle. Women experience more severe withdrawal symptoms and have higher levels of ongoing depression. So for many years, women were less likely than men to use illicit drugs. However, women are closing the gender gap. 40% of the rehabilitation programs do not provide any form of gender-specific treatment for individuals with a substance use disorder. And so that means that they're going to be male-oriented because, as I said earlier, most programs are designed to address 60% of the clientele, which is going to be white Caucasian males. As society has started to develop an awareness of increase in women's substance use, advertising companies begin to view women as an untapped market for alcohol use. So if you look at all the commercials, in this area for alcohol use, because we no longer have the cigarette ads, they show women in bikinis, glamour outfits. They're going to be either accessories or having fun themselves, but it's always in a sophisticated sexual tone to it. In the targeted advertising, alcohol use is portrayed as a sophisticated way for women to enjoy the company of friends. So women experience higher levels of stigma due to their roles, such as, because the fact that they're people see them as a caregiver or a mother, or that they could be pregnant, or as a sexual worker, or as a prisoner, or being of a particular ethnic minority. This is going to be associated, a stigma is going to be associated with every single thing that I just read off, because society has beliefs of how these women should look, act, and live. So being victims of sexual assault and intimate partner violence also leads to guilt, PTSD, and depression, thus calling for coping with alcohol and drugs as a coping mechanism to numb feelings and move on and live in denial. So in the problem statement, how we were just talking about intimate partner violence. Well, in the problem statement here, this is a good place to bring this up. Substance use disorders in intimate partner violence, which is also referred to as IPV, is interconnected with their safety as well as their recovery. So substance misuse is 2 times higher in women who experience intimate partner violence, along with PTSD, depressive disorders. Self-medication is one of the ways of coping strategies with these traumatic effects of abuse, as we just stated. Usually partners coerce them to use, and 27% in a research study were forced to or pressured to use alcohol or drugs by their partners. And so substance use disorders may progress differently for women. Well, and in addition to what we just said about that, there are many times these women who are abused are many times controlled by threats of deportation, arrest, CPS, that they're going to lose custody or they're going to tell their jobs. And once they're in treatment, if they happen to get into treatment, many times their recovery is sabotaged by being isolated from recovery resources, meetings, and follow-up care. And there's a big relapse trigger. The relapse trigger may be that they return to the same environment, the same setting with the same problems, and an abuse partner who is still using and insists that they use. And so this activates the pathways to resuming the use of drug and alcohol. So substance use disorders may progress differently for women than for men, we said earlier. Women have shorter histories of using substances, but however, they typically enter a substance use disorder treatment with more severe medical, behavioral, psychological, and social problems. It is estimated that 6.5 million women in the U.S. struggle with a substance use disorder. Women with an AUD are thought to be 23 times more likely to commit suicide than non-drinking counterparts. Women with a drug use problem are 50 to 100 times more likely to die as a result of their substance use disorder, including deaths from suicide, alcohol-related accidents, heart disease, and liver disease. Women seeking treatment for cannabis use disorder have higher risks of suicide than men in the same age range seeking treatment. The combined burdens of work, home care, child care, and other family responsibilities, plus attending treatment frequently, can be overwhelming for many women and lead to relapse. So, substance use disorder in women, it is now acknowledged that hormonal, pharmacokinetic, and neurochemical and social factors alter a woman's ability to biotransform substances and affect her vulnerability to and recovery from substance use disorders. Women show a quicker progression from first using the substance to developing dependence. Some unique issues women who use drugs face relate to their reproductive cycles. Some substances can increase the likelihood of infertility and onset of menopause. Substance use further complicates pregnancy and breastfeeding. Pregnant women using drugs can pass drugs to their developing fetuses and cause them harm. New mothers that use drugs can pass drugs to their babies through breast milk and cause them harm also. Women with SUD fears that they can seeking getting help, because then they're going to run into some legal or social problems, or they fear that the authorities are going to be removing their children from their care. So they'd rather not seek treatment if they can't, if they don't have to. And does gender affect rehabilitation problem? Yes, for a variety of reasons. I mean, here, men and women sometimes use drugs for different reasons and respond to them differently. So therefore, the rehab process, it's going to impact the rehab process as well. So women are more likely to suffer from a psychiatric disorder. Women with an AUD are 7 times more likely to have depression than men. So clients who have both a substance use disorder and another mental health condition often have symptoms that are more persistent, severe, and resistant to treatment compared to those who have either one disorder or the other. Both disorders should be treated at the same time for them to have any kind of success. Women are more likely to suffer from depression, anxiety, post-traumatic stress disorder, and eating disorders. So there are different brain activation patterns for each sex. There are social barriers and stigmas against SUDs in women. Women are more vulnerable to developing an SUD or a mental health disorder following a divorce, a loss of a child, a death of a partner, or a death of a child. And so women who are victims of violence are at increased risk for substance use, obesity, chronic pain, and depression. Women seen by physicians as patients rather than addicts is a problem. So in order to deal with them, the physician decides, okay, well, let's prescribe more antidepressants and anti-anxiety drugs, and then this increases the misuse of them. So there is limited funding for women's treatment and other limitations. Women are not to be included in most clinical research. Women, the reason that they don't include them in research is because some of the reasons is because they're biologically complicated more than men, and so there's too many factors to include in the research, and it complicates the research more, so they just go with an easier subject of men. Women are busy with being at home, doing their work, looking after kids, and this creates problems with them to get a schedule for them to participate. So these are good excuses to leave women out of it. And also, women are more vulnerable, and so insurance-related benefits and coverage because of their greater reluctance and in public to participate because they're in public insurance programs, and sometimes they pay for treatment and sometimes they don't pay for treatment. So because the women are that most programs are in research are based on these programs, and this program design is for men, a new policy was developed in 2014 that women need to be included in clinical research for anybody doing an NIH study and wanting NIH funding. So the effects of common drugs on misuse of women. Men and women metabolize alcohol differently due to differences in the gastric tissue activity, causing higher blood ethanol concentrations in women drinking than men. So the review of the AUD physical complications and interpersonal resources, again, are limited because there's so much more volumes of research on men. So girls ages 12 to 20 have slightly higher rates of alcohol misuse and binging than male counterparts. In regards to the review of amphetamine use disorders in women, women may be more vulnerable to the rewarding effects of stimulants, it's possible because of the estrogen being a factor for increasing the sensitivity to them, to stimulants. And so review of benzodiazepines misuse in women. This caused more women being sent to the ER. Women are more likely to overdose on antidepressants because they're being prescribed, most of them, antidepressants by physicians. Review of cocaine misuse and marijuana misuse in women. As far as cocaine, women are quicker to start taking cocaine in large amounts, affecting heart and blood vessels. And as far as marijuana use goes, fewer females than males use it. It impairs spatial memory in women more than men. And hallucinogen use and narcotic use in women, women have a harder time quitting smoking than men do. Women metabolize nicotine faster than men. Women are more susceptible to non-nicotine factors such as sensory and social stimuli associated with smoking. There's greater concern for, weight gain among women. They're more worried about uh, more sensitive to visual and olfactory cues as triggers, which is interesting that if they see something or smell a cigarette, they have higher sensitivity to them and triggering the cravings there. Women using meth for energy, women use meth for energy and decreasing exhaustion related to all the responsibilities they have. And so, because they use meth and you're later on a downer after you've been on the high, there's a high co-occurring condition of depression because they're trying to treat the depression with the meth so that they can get everything done and do well. So that concludes our chapter here on that. And so on women in treatment and the lack of programs addressing women's needs. And I included a video that's kind of interesting called Life Stories from Women in Recovery. And it's a person who's involved in theater who was involved in having these women express their stories about why they got into drugs. Thank you. Bye-bye.